What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. And if you had to take a test for any other virus you may be sick with at the moment, I hope you've tested negative. And if you are sick, I hope you get some answers. And of course, if you tested positive, I hope you have a full and speedy recovery. It is time now for the Thursday edition of the Virus Update for Thursday, January 16th, 2025. If you are new to my channel, welcome to my channel. This is where I give the daily virus update as needed on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there. And this winter, all the viruses combined together has hit areas pretty hard. I was actually hit by one of the viruses recently. Yes, COVID did hit me, and I'm still dealing with some post-COVID issues. We'll talk about that in a little bit. So if you want to stay informed with what's going on with all these viruses, subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Let's try and reach 200 like button hits today. And of course, my goal by the end of this year is I want to see the channel grow to 10,000 subscribers. I think we can do that. You guys have been doing a great job of sharing these videos. Alrighty, before we get into all the news and data of the day, I got to give an update on me. Because remember yesterday I said I was feeling better. That was true during the day yesterday. Headache was on and off throughout the day. Then last night the headache, like that, turned back on. And another bout of the chills or shakiness came back last night as well. I don't know. It happened around about 10:30, 11, we'll say around 11 o'clock last night. I was like, okay, this just came out of nowhere. Post-COVID, it can be unpredictable. It can also eventually become long COVID if it lasts long enough. My fingers are crossed. I don't go that route, but these headaches, they are really annoying. It's been on and off bothering me today. I just took a Motrin about a half hour before this video. And if you notice, yes, I tested again today to make sure I'm not rebounding. And take a look at this. I'm holding this as still as possible. And yet again today, the shakiness has come back. There's nothing I can do to stop that. I don't know what's causing it, but yes, it's going to be day by day. I hope to eventually get back to work. My plan was to slowly ease my way back to work. You know, just do a couple hours each day and then eventually build up to a full day of work. That's going to probably start next week, and we'll see. I might try and drive somewhere tomorrow, but it all depends on how I feel. Alrighty, we do have quite a few things to get through today. I think this may be one of those over 20-minute videos. We'll see. Starting off in Chicago, the first two news stories have to do with bird flu. Chicago is sees beloved seal and baby flamingo die from bird flu. This is at the Chicago Zoo. And this is not good. And it does sound like they do have a plan in place to prevent other animals at their zoo from becoming sick with bird flu. And they are saying that the general risk to the visitors of the zoo is low at this time. But quite frankly, to be honest with you, if you're going to visit the Chicago Zoo right now, I suggest you probably should wear a mask. I think it's just the right thing to do because there are a lot of unknowns with bird flu at this time. In Austin, Texas, bird flu is being found in ducks. The Park and Wildlife Department offers recommendations to stop virus from spreading. So yes, we are seeing bird flu cases show up in Texas in ducks, and I've been seeing a lot of bird flu news today. All the bird flu news when it comes to animals, just not in the United States, internationally, will make it into the two separate threads for that. We do have the U.S. bird flu tracking thread for animals, and we do have the international one. My website, datareport.info, but I will show you the website in just a little bit. And of course, there is a human section. Have not seen any H5N1 bird flu human news today so far, so that is good news. All right, in Michigan, 3 illnesses are climbing in Michigan, the CDC says. And reminder that they're saying climbing. Some of this is because of data that could be 1 to 2 weeks old. The CDC and other agencies, such as state agencies, are still behind. Remember, we are in transition to a new president administration, so that is making data behind, such as COVID variant data. I don't know that we're going to get that back, but hopefully we do. In Michigan, they're reporting flu, RSV, and COVID-19 are on the rise, and this may actually still be true because on the most recent update, I believe the coloring shade of high in Michigan did actually go up a little bit. Some of the northern states are the last to peak when it comes to all these viruses combined together. Taking a look at this now. HMPV, you heard a lot about this in China. I did not talk much about it because there are a lot of articles out there making a big deal out of it or blowing it more out of proportion than it should be. And someone's probably getting ready to make a comment right now. Well, it really is a big deal. You should be saying more about it. Until we actually get some concrete evidence that it is causing anything worse than normal, not just in China, but all around the world altogether. Until then, I'm not going to go over reaction about it because I don't want to blow it out of proportion. I'm just going to try and keep things with a steady hand and, well, can't be steady because I'm shaking, but you get my point. I'm trying to just be level on it, and if things do start going bonkers, then of course, yes, I am going to talk more about it. And here in the United States, it has increased somewhat, and it says here that the national positivity level is 1.77%, and it says one area of the U.S. is seeing an even higher positivity rate, and that is Iowa, Kansas, Missouri, and Nebraska, where more than 5.8% of tests submitted for HMPV tested positive through the first week of the year. So, again, it is something we definitely have to keep an eye on, but at this time, it's not something we should be, oh my, this is going to be the next 2020. Not at the moment. So we just got to keep an eye on it for now. All right, Harrisville School to have 4-day weekend due to illnesses. This is a paywall article. I said, you know what, let's just add it in there anyhow, because we can just even seeing a little bit of the story, we can kind of get the idea of what's going on. And in case you're wondering, it says Harrisville Central School. This is in New York State, and you can see up here, St. Lawrence, Louis, Oswego. So yes, this would be New York State. And it does say here they're having a 4-day weekend in hopes of slowing down the spread of illnesses which have been circulating throughout the school. We get the idea. Illnesses are circulating there. Trust me, that's not the only school. It's just one of the only ones we're hearing about in the news. I'm sure there's lots of schools that are having problems. There's probably those Facebook groups where, Parent-Teacher Association Facebook group for such and such school. I'm sure it's popping up with notes saying, hey, my son came home sick the other day. He has a fever. Just wanted to let you know. Be cautious. All that. It's going around right now. I'm seeing it in community groups. I saw a community group. Someone says, if you go to such and such school, just such and such class is dealing with illness. Yep, it's that time of year. People are dealing with that right now. This caught my attention yesterday, and I thought this was rather interesting. This was tweeted out by Jammer. If you don't follow this account, it is a fantastic account, and we're just going to quickly go over this. Basically, what's happening here is American Airlines flight attendants now face being terminated if they catch COVID-19 under harsh new attendance rules. Wait, what? They could be fired for catching COVID? Yeah. And what that means is, say they test positive for COVID. Well, if they do not show up to work under these new rules, in certain circumstances, if they do not show up while positive for COVID, they could in turn get that pink slip or whatever it may be and say, sorry, you're going to be fired. And there's going to be a point system. Once you rack up too many points, that's it. Is that ridiculous or what? And we need to discuss this for a second. That's not only putting the coworkers at risk. Who here, raise your hand, leave a comment down below. If you knew that an airline was saying, hey, the workers need to come to work while positive with COVID, how many here would raise their hand and say, I'm not flying with that airline anymore? I think a lot of people would say that. If you knew that such and such person is going to be positive on that flight, I think that would be like, okay, are we going to get sick on this flight? I mean, you have all walks of life that fly on airplanes. You have normal, healthy people. You have people in between. You have high-risk, immunocompromised people. You are putting them at risk. This is a horrible policy. I mean, what is this? American Airlines is trying to keep up with Delta or something? Who remembers back and he actually puts something down here. Who remembers when Delta was saying, hey, they wrote a letter to the CDC saying, the isolation period should be lowered from 10 days to 5 days. Well, like magic, the CDC says, you know what, you're right. Let's lower it to 5 days. Totally, totally ridiculous. All right, moving on to our next story. But before we get to that, here is your reminder that we need to hydrate ourselves. If you are recovering from COVID or still have COVID, let's do a hydration break right now. Very good. Saves my voice. You can see my voice still gets a little messed up from time to time. Respiratory illnesses numbers are rising in the state of Maine. Maine is reporting a rise in COVID, the flu, RSV, and whooping cough all at once. And like I've been saying, when an area or a country or anywhere gets all these viruses going up all at once, you know what that means? More of a strain on healthcare. It's not just one virus. Someone says, oh, no big deal this year. It's all the viruses put together. And I must remind you, norovirus in the United States is really bad this year as well. The Maine CDC says there have been about 100 flu-related hospitalizations this year. So that's quite a few for the state of Maine. Remember, Maine is not one of the bigger states, and Maine, while land-wise it is, their population increases more in the summertime because they do have some seasonal residents that live there in the summertime, then go south to places like Florida in the wintertime, or Arizona, those type, the snowbirds. Taking a look at this, New South Wales, this is from the COVID info guy. If you don't know where that is, we're talking about Australia here. And the respiratory surveillance report weekly ending on January 11th, the COVID positivity rate dropped by almost just about 0.5% to 9.2%. COVID, 2,319 cases. That was actually up slightly. And I do believe this is laboratories reporting, yes, 3 out of 4. So these are cases. Influenza, 1,276. And RSV, 384. RSV drop. Looks like influenza saw a big increase, 99.6%. If I'm reading that correctly. Pertussis, whooping cough. Looks like notifications for whooping cough dropped significantly. That is good. And it does look like the XEC variant is now at 54% in this area. And it looks like COVID-19 sewage treatment. Looks like some parts are rising, some parts are dropping at this time. And that really is a big time flu increase for summertime. Someone actually asked that here. And it says influenza activity increased over the last few weeks, which is likely influenced by travelers returning from their northern hemisphere countries where influenza activity has been on. So apparently they see people that come here to the northern hemisphere at this time of year. Then they travel back and bring flu back with them. I did not know that was a thing in Australia. All right, winter bug norovirus surges in Minnesota with unusually high number of cases. Not much to be said about this. Norovirus has been unusually high across the United States, and Minnesota Department of Health reported 76 outbreaks of norovirus in December, 3 to 4 times the usual number for this time of year. Each outbreak represented more than 1,500 individual cases. So, one person gets it, then it goes like a family tree and it keeps spreading. And that seems to be what was happening with that. All right, in Indiana, Beacon Health System, a healthcare organization in the state of Indiana, has updated their visitation policy as of January 15th, 2025. This was posted to my site by moderator Steve. Always posts fantastic information. I thank everyone who makes posts on my site. I really do appreciate that. The more who do it, the better. It is free to sign up to my site, datareport.info. Anywho, Beacon Health System in Indiana is recommending that visitors do wear a mask once again. And you guessed it, rising respiratory cases. In Canada, the viral activity level for COVID is moderate, flu A is high, flu B is low, and RSV is high at this time. All right, let's take a look at what's going on in the UK for the different viruses. And we do see for COVID at this time, good news, bad news. Good news, hey, cases are down. They're down just slightly. 918 weekly cases, and that was down by 1.5%. The bad news is deaths went up. This is a pretty big death increase. 89, that's up by 36 or 67.9%. In healthcare, 114. Decrease the number of patients in healthcare. That's down by 114. Patients admitted was 892. Good to see that down by 11.3%. Cases, they're just not really dropping all that much. I mean, they're not all that high. And remember, a lot of people do take these at-home tests when it comes to cases. So a lot of the cases just don't get reported. And with healthcare patients admitted dropping, it makes sense that we are seeing the backside of whatever wave they did have. It may have been a silent wave. We're seeing the backside of it now with deaths, and deaths may go up maybe another week or two and then peak and eventually drop. They may even drop as soon as next week. All right, taking a look at what's going on with the air qualities in the United States, and we'll see here that still some problems in the West Coast and some problems across the Great Lakes today. Don't know what that's all about. There is a minor Clipper weather system moving through. Sometimes that does set off the sensors, so I don't know if that's what the case is today. In Pinellas County, Florida, we are seeing here, there are a few calls right now. Sick person, stroke showing up a few times, headache is showing up a few times, so that's never a good thing. And taking a look at what's going on in Philadelphia when it comes to EMS incidents, I do need to add this here. Whoa. Okay, I'm just seeing this for the first time today. 860 EMS calls were reported. Just retweeted that. That's a really high number. That's not a number that I like to see. In Montgomery County, Pennsylvania, got to look at this a little different today because the usual way that we show where the list where we go down, that's not working for some reason. And it could be because there are a lot of accidents right now. We're having snow showers here. And we do see, there are definitely calls. Any of these blue markers, that's calls. And there's a lot of them. 28 medical incidents, but I want to draw your attention to that. That does usually lag on this map. So if we had the list working, it would not show 28 right now. It would probably maybe show north of 15, though. And that's a lot of EMS calls. And Chester County, don't be alarmed. You're going to see a ton of calls. Again, we're having snow showers. It has led to a ton of accidents in this area in southeast Pennsylvania. But nonetheless, there are quite a few EMS calls. Cardiac arrest, that's not from an accident. Respiratory emergency, heart problem, stroke, respiratory emergency again. So, there are quite a few problems ongoing right now. Not good to see. Taking a look at what's going on with the hospitals in Pennsylvania, and we are seeing some problems still. Southeast Pennsylvania, wow, getting hit really hard. Disregard to one north of Norristown, Pennsylvania. That has not updated since last year. I don't know what their deal is. Carlisle, Pennsylvania is having problems. And even up near Pottsville, Pennsylvania, between Pottsville and Hamburg, there is a problem there. And it says Geisinger St. Luke's Hospital. Emergency department near capacity. That's not a good thing. Let's check in what's going on with New Jersey today. And we do see 1, 2, 3, 4, 5, 6 hospitals dealing with problems there today. And we do see patient volume seems to be the issue for these hospitals today. Taking a look at Pennsylvania wastewater data, I have some good news to report here. Take a look across the state of Pennsylvania. You're seeing a lot of wastewater sites that either say no change or that light blue color, which means a decrease in activity in wastewater. Still seeing an increase in Center County, Pennsylvania. That could be because Penn State University students are now back. That could be resulting in somewhat of an increase. I've looked at some individual wastewater sites, and some of them that did peak, a couple of them are starting to go back up again. So that's rather interesting to see. But overall, statewide, at least in wastewater, it looks like Pennsylvania has finally peaked. Walgreens this week, national positivity rate was 13.2%. Real quickly, I did want to show you something in wastewater today. Now remember, the start of the week with wastewater scan. Not always reliable, it corrects. And then at the end of the week, we see the corrections that come in. And here's the national national COVID chart. And we can see here, it had peaked. It was dropping. Then it's starting to go up a little bit again. And there's this wonky movement at the end. X that out. Even if you X that out, it's not really dropping anymore. So that's something we have to keep an eye on. And again, I've been saying this for days. We don't know what the variant picture is in the United States right now. Is XEC still the dominating variant? Or is it one of those other variants that were up and coming and they're getting close to take over? Don't know. I hope we get a COVID variant update from the CDC tomorrow. Again, with changing administrations of presidents right now, it's uncertain if we will. RSV, nationally, I mean, there's no wonky movement here. It just continues to rise. Influenza A, that is peaking. Influenza B is peaking. HMPV is low, and all these others. Well, norovirus, no, I got to mention, norovirus, though it's peaking, is still really high at this time. We'll take a look at some more wastewater data another day. We still have quite a few things to get through just yet. I have to show you this. This is not good. And I think this may be a data dump. I'm not 100% certain. New York State today. Usually on Thursdays, New York City gets added in. Even with that being considered, look at this. It's higher now than it's been since December 30th. 1,643 new cases added today. Again, I think a lag data dump may have been added. Nonetheless, we will keep an eye on it just in case. Maybe they're going to go towards a double peak. I don't think that's happening, but again, cases, they're just unusually high number compared to the past several days, which were dropping. So, and you can see here, look how low some of these days were. There definitely could have been a lag within there. And I think we're going to see that with a lot of various different data. I think we're going to see that with CDC data coming up soon. I would be surprised if we don't. Hospitalizations in New York State. This is as of today, 896 and 103 people in the ICU. Ending today with, well, not ending, we got more to show after this. Ohio is reporting that cases were 5,531 COVID cases. That did drop. Hospitalizations, 308 reported over the last week. That's not the number of people that are currently in the hospital. That's just added to their total number, which since this pandemic started, and mind you, not all hospitals are checking for COVID. 157,120. That's a lot. But that's from the beginning of the pandemic. And ICU admissions, 9. And deaths are starting to rise in Ohio. 31 deaths reported. In Colorado, the number of hospital admissions for COVID, 157. Influenza, 282. And RSV is at 100 at this time. All right, I do have something else to show you here, and this is some data from CJS A3172. But before I do that, I forgot to put it in the notes here. All of the virus updates we did while I was positive with COVID, I am going to make a separate playlist here on my channel just so you can go back during those times and see how I progressed. You know, the beginning of the videos and some of them at the end gave updates on me documenting my case. I am going to do a little playlist of that. Maybe I'll set that up this evening, and who knows, maybe down the line we might have a playlist of the long COVID days. I'm hoping not, but you know, with some of these symptoms still coming and going as they please, it's something we have to keep an eye on. Anywho, we're just going to read this data, and that's going to be it for today. So first off, CJS said for Tuesday, Florida's daily number was 472 new cases. New Jersey was a weekday number. That was 978 new cases and 8 new deaths. New York, this was a daily number, 883 new cases. Puerto Rico had 215 new cases and 3 new deaths. Maryland had reported a weekly number of 1,074 new cases and 36 deaths. For the most part, the deaths are a 2-week update, as only 4 deaths were reported there last week. Maine had 819 new cases and 5 new deaths. Michigan, weekly number, 4,737 new cases and 38 deaths since the beginning of December. A total of 100 were added, including 59 from January 2023 through July of 2024. You're getting a picture here. I think it's going to be another elevated week of death reportings, and some of these really far back lags. Virginia, 2,618 new positive tests and 23 deaths reported by the CDC. Then in his Wednesday report, Florida, a daily number, 505 new cases and 7 new deaths. New Jersey, weekday number, 408 new cases and 4 new deaths. New York, daily, 810 new cases. And remember, today's number is significantly higher than that, just about double that. Puerto Rico, daily number, 416 new cases. Delaware, weekly number, 292 new cases and 2 new deaths. Hawaii, weekly number, 208 new cases. Indiana, weekly number, 2,452 new cases and 14 new deaths. North Dakota, weekly, 434 new cases and 1 death reported by the CDC last Friday. Nevada, weekly, 400 new cases. Oregon, weekly, 153 new positive tests and 11 new deaths. South Dakota, weekly, 565 new cases and 5 new deaths. Tennessee, weekly, 1,377 new cases and 39 new deaths over the past 3 weeks. Washington, weekly, 312 emergency department visits and 9 new deaths. Alrighty, that was a ton of information we went through today between news stories, data, cases, all these different things that we looked at. And tomorrow already looks to be another busy day. If you enjoyed this update, give it a thumbs up. Let's try for 200 plus like button hits today. And of course, subscribe if you're new down below. Maybe you've been watching these videos for a few days and thinking, maybe I should subscribe to this video, to this channel. Today's your day. Do it. Let's hit 10,000 subscribers this year. Share this video with anyone you know. And of course, leave your comments down below. And remember to hit that notification bell. Details to the website and all the other things that I have are in the description down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.